The question we're going to tackle today is it possible to be continuously old? Welcome back to the channel where we answer the question, why does this keep happening to me? If you've never seen one of our videos before, this is a good time to mention that we are medical professionals. We're doctors, nurse practitioners, physician assistants, pharmacists, and we all have one thing in common. We love teaching and learning about your health. So if you find our content useful or educational, please subscribe. We really appreciate your support. One of the hallmarks of aging is that our risk of certain diseases increase as we get older. One of those diseases is cancer. In fact, if you look at statistics, you will see that cancers are very rare under the age of 45. They start increasing after that, and by the time you hit 70, depending on your sex, your race, other factors, your risk of getting colon cancer is up to 5%. Breast cancer in women is also rare before 45. It increases after that. By the time you hit 70, it's around 2%. Lung cancer is fairly common in men and women over the age of 65, around 1 to 2%. That might not seem like a lot, but when you think about the fact that 1 out of every 3 people die from heart disease, cancer is actually second only to heart disease. And in this century, cancer is expected to surpass heart disease as the leading cause of death. So clearly, anything we can do to reduce our risks of getting cancer is very important. Today, we are going to talk about some simple things that you can do to keep yourself from being continuously old. As always, we want to remind you that nothing in medicine is absolute. This isn't one of those black and white things. So, as we go through this, we encourage you to think about what your own risks are, what your own goals are, and discuss them with your doctor. First off, let's talk about colon cancer. Colon cancer is one of those cancers that tends to stay silent until it is relatively late in the game. It usually doesn't cause any symptoms until it's already spread outside of the colon. So one of the ways that we can potentially avoid being continuously old is to catch these things early. There are a number of different tools that we have available to us to screen for colon cancer. The main tool that we use for colon cancer screening is the colonoscopy. It's kind of nasty. No one likes to get a colonoscopy, but they're relatively safe. There are some risks to them, but overall, they're quite safe. During a colonoscopy, a camera is inserted into the colon, and we can look at the inside of the colon to check for polyps or lesions or changes that may be concerning for cancer. Not everyone needs to get a colonoscopy, though. There are other options available, like CT scans of the colon or DNA tests in the stool. But, for many people, your primary care doctor or gastroenterologist will recommend a colonoscopy starting somewhere between 45 and 50 years old. And then you probably need to get one every 10 years after that to continue screening for colon cancer. There are guidelines about who should get screened earlier or more often. And those include having a family history of colon cancer or polyps, or other things like inflammatory bowel disease, which can put you at higher risk for colon cancer. So talk to your doctor about whether or not you fall into any of those categories and whether you need to get screened earlier or more often. Also, there are now trials looking at whether people who have had a colonoscopy and then get a pill camera afterwards. So basically doing 2 screenings at once. So there are new things coming down the pipeline that may allow us to screen even more effectively for colon cancer in the future. Another thing we can do to avoid being continuously old is to check our skin for unusual moles. Many of you have probably heard of melanoma, which is a type of skin cancer. Melanoma is actually relatively rare, but it's still pretty deadly. The reason it's so deadly is because when it does spread, it spreads quickly and it spreads to places that are difficult to treat. So catching melanoma early is extremely important. A way that we can avoid being continuously old is to catch melanomas before they become life-threatening. So one way to do this is to just keep an eye on your moles. Moles are brown pigmented spots that can be anywhere on your body. You can have hundreds of moles. Most of them are harmless, but every once in a while, a mole can change and become something more serious. So we want to keep an eye on the moles for signs of change. There's a mnemonic device that we can use to remember what to look for when examining moles. The A stands for asymmetry. So we want to make sure that both sides of the mole are roughly symmetrical. The B stands for irregular borders. So we want to make sure that the borders of the mole are nice and smooth and regular. C is for color, so we want to make sure that the color of the mole is consistent throughout. And D is for diameter. We want to make sure that the diameter of the mole is less than 6 millimeters. So if you notice any changes in a mole, especially if you notice that it's growing or changing or becoming asymmetrical or having irregular borders or changing colors, then you should talk to your doctor about it. You do unnecessarily need to get a full body check from a dermatologist every year to check your moles. You can do it yourself. You can look at your moles and look for changes. But you do want to make sure that you're keeping an eye on them. And if you notice any changes, definitely talk to your doctor about it. Dermatologists can do biopsies of suspicious-looking moles. And if they take a biopsy of a mole and send it off to pathology and it comes back positive for melanoma, then they can stage it to see how far it has spread and determine what the next course of action is. Early-stage melanoma has a 5-year survival rate of 98%, but when it's spread to distant organs, that 5-year survival rate drops to 15%. So, catching these things early is extremely important. Again, you don't necessarily need to see a dermatologist every year to get checked, but if you notice changes in your moles, definitely talk to your doctor about it. The last thing we're going to talk about today is just getting regular medical exams. For many conditions, the biggest predictor of survival is early detection. Even for things like heart attacks or strokes, where someone presents to the emergency room with chest pain or trouble speaking. Those conditions are much easier to treat when they're caught early. One way that we can avoid being continuously old is to try to catch things early before they become a problem. And that's the goal of regular physical exams. When you go to see your doctor for a well visit or a checkup, your doctor will be able to listen to your heart and lungs. They'll be able to check your blood pressure. They'll be able to check your reflexes, check for signs of weakness or numbness, and they'll ask you questions about how you're feeling and how you're doing. All of these are ways that your doctor can assess your baseline level of health. Your doctor will also draw blood and check a basic metabolic panel, a lipid panel, a complete blood count. Maybe a kidney function test? These will check for signs of diabetes, signs of kidney disease, signs of liver disease, signs of high cholesterol, anemia, infection. There are many, many things that we can check for during a routine exam. And these are all ways that we can catch things early and potentially avoid being continuously old. Why does this old man keep showing up to the doctor? Let's find out in this medical mystery. It was early in my career, and I was working in a busy emergency department. We had recently taken over the care of an elderly gentleman who had been found wandering around his neighborhood by the police. He lived alone and had no known medical problems. He had, however, been reported missing from a dementia care unit where he'd been living for the past year. He had a tag on his wristband that said, "Dementia patient." His wife had come in to see him and she told me he had a recent tendency to wander. He could usually be found just around the corner in the same street. It was only today that he'd gone a bit further afield. He didn't have any money on him, or any ID. The police had found him and brought him back here. I started chatting with the old man while waiting for the ambulance that would take him back to the dementia care facility. I asked him, "How are you going?" He looked at me and replied, "Still." I asked him to clarify what he meant, and he responded, "Still good, still sad." And he continued to repeat, "Still good, still sad." He wasn't agitated, but he wasn't making eye contact either. I asked him a few more questions about his mood, and he said, "Sometimes happy, sometimes sad, sometimes angry, but mostly tired." I thought about asking more questions, but at that moment a very senior doctor from the team walked by and was introduced to our patient. After a quick chat, he took charge of the situation. "Don't worry," he said to me. "I've got this." To me, that meant he was going to take over and I could go and do something else. But instead, I heard him say to the patient, "So you're staying at that place down the road?" Gesturing with his head towards the dementia care facility. "That's right," the patient said. The doctor leaned in closer to the patient and whispered something in his ear. I couldn't hear what he said, but it made the patient visibly uncomfortable. The patient shook his head and whispered, "No, that's not right." The doctor louder now, "You don't live there. You live with your wife?" "That's right, isn't it? With your loving wife." The patient looked away and muttered, No, that's not right." The doctor persisted, "You live with your wife. You've got a wife, don't you?" The patient looked at the doctor and slowly started shaking his head back and forth, faster and faster. No. And then he started screaming at the top of his lungs. "No, I don't. He was inconsolable, thrashing around, and the nurses had to hold him down. The doctor backed off, looking very smug, and said to me, "See, they always know when they're lying." And he walked away. This old man is clearly suffering from dementia, I thought to myself. So why was he shouting at him and trying to convince him of things that weren't true? A little while later, I was able to look at the patient's notes. I read that the doctor had asked him where he lived and the patient had given an address that was the name and number of a local dementia care home. This wasn't the address of the home where the patient actually lived. The doctor had gotten the wrong address and then tried to convince the patient he was wrong. Why had he done that? Why did he shout at the patient and call him a liar when he became agitated? And what did he think he would achieve by saying that the patient lived with his wife? What did he think the patient was hiding? Was he trying to protect the patient from something? I remember feeling so angry at the time. I couldn't believe how the doctor had treated the patient. But most importantly, I felt confused. Why was the doctor doing what he was doing? Fast forward 20 years. I'm now a seasoned emergency room doctor. I see many patients like this old man every month. But what I notice is that the condition seems to be getting worse. Many of these patients seem more confused than before. They also seem more depressed. I've seen many patients who, like this old man, wander away from home because they feel better outside. Some of them stay outside for days or even weeks. When they get cold or hungry, they come back inside again, usually to the same places. They often end up in hospitals or emergency departments. Many of them are dehydrated or have eaten very little. They can be very disoriented and sometimes aggressive when they are picked up by the authorities and brought back to a safe place. Sometimes they're picked up several times a day, but most of the time, I send them back home because I am not sure if they need anything from me. I often wonder how long they will survive out there. A few years ago, one of these patients stayed in the hospital for several weeks because he wouldn't eat at home. Social services were called in and they decided he should be moved into a care facility. When he was admitted to the care facility, the staff did some screening tests. The results showed that he had both depression and early dementia, and this is when it hit me. Mental health also needs prioritizing. Depression can make you lose interest in life and it can make you feel very low. Depression can make it hard to concentrate. It can make you apathetic and unresponsive. It can make you feel hopeless and bring you down. It can make you feel sad, empty, and numb. Some people withdraw and don't want to talk. Some become agitated and restless. It can make you do things you wouldn't normally do. In short, depression can mimic dementia. Now, let's go back to the story. The old man in the story was indeed suffering from dementia, but he was also deeply depressed. I realized that much later. When a person has depression, they can shut down and withdraw. They can become unresponsive and stop communicating. When that happens, doctors have a hard time deciding whether they are suffering from depression or dementia. If the patient doesn't respond to questions, the doctor may assume that they are cognitively impaired. But if the patient is actually depressed, they may be perfectly aware of what's going on around them. They might just be too overwhelmed with negative emotions to communicate. If we had spoken to the old man for a bit longer and asked him more questions about how he was feeling, he would have told us that he was depressed. He wasn't having trouble with his memory or thinking. He was having trouble with his feelings. Now, the thing is, men aren't often comfortable talking about their feelings. So if we hadn't figured out that the old man was depressed, he might have spent many years being labeled as having dementia. But once we understood that he was depressed, we were able to treat him accordingly. It's very important to screen all older adults for cognitive problems and depression. Cognitive screenings are simple and quick and can be done by anyone. Asking questions like, "What brings you in today?" or "What brings you to the hospital?" is a great way to start a conversation about someone's mental health. Having open conversations about our feelings can help us to identify problems early on. Most of the time, identifying a problem early means that treatment will be much easier. Some people might not want to talk about their feelings. They might try to change the subject, or they might try to avoid the person asking them questions. But it's important to keep trying. It's important to let people know that it's okay to talk about their feelings. And it's important to let them know that there are people who can help them. Men tend to prioritize work and other responsibilities over their own mental health. Men also tend to be less likely to seek professional help for mental health problems. But this is a harmful stereotype. Everyone needs to take care of themselves, and everyone needs to be able to talk about their feelings. Everyone needs to be able to tell the difference between sadness and depression. When we see an older person who is struggling, we often assume that it's because they are mentally unwell. But it's important to remember that they may be struggling with their mental health for other reasons. It's important to ask questions and listen to the answers. If we do this, can help older people to get the help they need. Today, cognitive decline is increasing worldwide, but we can do a lot to prevent and treat it. One of the best ways to do this is to have regular cognitive screenings. Cognitive screenings are a simple and effective way to identify cognitive impairment early on. Early identification allows for early intervention, which can slow down the progression of cognitive impairment. Cognitive screenings can be done by anyone. There are many resources available online and offline. All you need to do is ask a few questions and observe the patient's responses. If you notice any signs of cognitive impairment, please encourage the person to seek professional help. Don't ignore it. Don't delay it. Early intervention is key to managing cognitive decline. Depression is a common mental health condition that can affect anyone, but it can be particularly challenging for older adults. Older adults who suffer from depression may be reluctant to seek help or may not even realize that their symptoms are treatable. Depression can manifest differently in older adults, so it's important to be aware of the signs and symptoms. These include changes in sleep patterns, appetite or weight, social withdrawal, feelings of hopelessness or worthlessness, and difficulty concentrating. If you notice these signs in yourself or someone you love, please reach out to a mental health professional. Depression is treatable, and there is hope for recovery. Please don't hesitate to reach out for help. What are some common traits of an old man? I guess we all have our own personal idea of what an old man looks like, what their personality is like, how they talk, etc. But if you were to make a list of the most common things that come to mind when you hear the phrase old man, then I'm sure most people would include things such as being forgetful, having aches and pains, being grumpy, being very slow, being a bit senile, and so on. But there is one trait that is perhaps even more common than all of those combined. It's something that old men tend to deal with for many years, yet it's something that they are too ashamed to admit they have a problem with. And unfortunately, this leads them to suffer alone in silence for many years, until it's too late. Welcome back to the channel. Today, we are going to be taking a closer look at this very common, yet often overlooked issue that affects millions of older men around the world. But before we get into that, make sure to hit that subscribe button so you don't miss any new videos. You see, there are a lot of different problems that can affect us as we age. There are physical problems, mental problems, emotional problems, and sometimes a combination of all three. But out of all these problems, one of the most widespread yet often overlooked issues among old men is hearing loss. It is estimated that approximately 360 million people around the world currently suffer from some degree of hearing loss, with the numbers continuing to grow each year. And while it's true that anyone can suffer from hearing loss, regardless of age, it is especially common among older adults. In fact, studies show that age-related hearing loss is one of the most common health conditions among people over the age of 70. Hearing loss can cause a lot of frustration, confusion, and social withdrawal, but it's often ignored or simply put up with until it becomes a major problem. Now, it is important to understand that hearing loss doesn't always mean that you can't hear anything at all. It is more common for people to experience a gradual decline in their ability to hear high-frequency sounds such as consonants, which can make it difficult to understand speech, especially in noisy environments. As time goes on, this can lead to a lot of misunderstandings and frustration, not only for the person suffering from hearing loss, but also for those around them. The problem gets even worse when you consider the fact that many people with hearing loss often do want to even realize that they have a problem. This is because it happens so gradually that they just adapt to it and do you and realize how much they've lost until it is too late. Even when people do realize that they're suffering from hearing loss, they may try to ignore it or simply wait until it gets better. Unfortunately, this can lead to serious social and psychological consequences. As I mentioned earlier, hearing loss can cause a lot of frustration, confusion, and social withdrawal. As communication becomes more difficult, people with hearing loss may start to avoid social situations altogether, which can lead to feelings of isolation and loneliness. This is especially true for older people who may have already lost a lot of their friends and family members. But that's not all. Hearing loss has also been linked to a number of other physical and psychological problems, including depression, dementia, anxiety, sleep problems, and a higher risk of falling. This is because people with hearing loss are more likely to be socially isolated, which can lead to a number of negative outcomes. Studies show that people who suffer from hearing loss are 2 to 3 times more likely to develop dementia than those who have normal hearing. This is probably due to a combination of factors, including the fact that hearing loss makes it more difficult to communicate and process language, which can lead to cognitive decline. Additionally, people with hearing loss are often socially isolated, which has also been linked to an increased risk of dementia. This is why it is so important to take action as soon as possible if you notice that you or someone you love is suffering from hearing loss. Fortunately, there are now a number of different treatments available that can help people with hearing loss to communicate more effectively and reduce their risk of developing other physical and psychological problems. The first line of treatment for most people with hearing loss is hearing aids. Hearing aids are small electronic devices that are worn in or around the ear to amplify sound. They can be very effective at improving a person's ability to hear and communicate. But it's important to remember that hearing aids are not a cure for hearing loss. They simply make it easier to hear by amplifying sounds. In addition to hearing aids, there are also a number of different surgeries and other interventions that can be helpful for people with hearing loss. For example, cochlear implants are electronic devices that are surgically implanted in the ear. They work by bypassing the damaged parts of the ear and directly stimulating the auditory nerve. Cochlear implants can be particularly helpful for people who are deaf or severely hard of hearing. Now, while these treatments can be highly effective, it's important to remember that they are only available to people who have access to medical care. Unfortunately, this is not the case for everyone, especially in developing countries where hearing loss is often stigmatized and untreated. So what can we do to help raise awareness of hearing loss and encourage people to seek treatment? Well, one of the best things we can do is to educate ourselves and others about hearing loss and its consequences. It's also important to create a more supportive and understanding environment for people with hearing loss. This means being patient and understanding when communicating with someone who has hearing loss, as well as being willing to make reasonable accommodations. For example, if you're talking to someone who has hearing loss, it's important to face them directly, speak clearly, and avoid using slang or idioms. You may also want to consider using written communication, such as notes or text messages, to supplement verbal communication. By taking these simple steps, we can help create a more inclusive and supportive society for people with hearing loss. We can also help break down the stigma surrounding hearing loss and encourage people to seek the treatment they need. If you or someone you know is suffering from hearing loss, please reach out to a qualified healthcare provider today. With early intervention, it's possible to prevent the further decline of hearing loss and even improve quality of life. So, please don't delay. Take action today and help ensure a brighter future for yourself or your loved one. Some people might think that it's not a big deal to have a little trouble hearing, but it can actually have serious consequences if left untreated. That's why it is so important to pay attention to any changes in your hearing and take action if necessary. You might be thinking, "Oh, I'm too young to worry about my hearing." But the truth is that hearing loss can happen to anyone at any age, and it's usually a gradual process that happens over time. You might not notice it at first, but eventually it can become more and more difficult to hear, especially high-pitched sounds like consonants. It can be tough to admit that you're struggling to hear, but it is important to take care of yourself and your loved ones by facing the problem head-on. Don't let hearing loss cause you to miss out on important moments or conversations. With early intervention, you can keep enjoying life to the fullest. Ignoring hearing loss is a common mistake that many people make, but it can have serious consequences. It's important to take action as soon as you notice that you're having trouble hearing, and that includes getting your hearing checked so you can get the help that you need. This old man never stops coughing. Why? Because he's suffering from a disease that affects many elderly people. And if you don't know what it is, stay till the end. I'll tell you how you can avoid this fate. This old man is not like any other. He was born in 1934 and worked as a journalist until his retirement. He was married and had 2 children and 4 grandchildren. Everyone loved him, and his sense of humor made him popular among his peers. But now, no one even remembers his name. How could this have happened? What did this man do wrong? In fact, nothing. It just so happened that in old age, a person needs to take care of their health more than ever before. And he didn't do it. This is a story of a real man who is now 86 years old. He asked not to be named so as not to scare his family with his illness. After all, he didn't want them to think that Grandpa had lung problems because of his habit to smoke a pack of cigarettes a day. But in fact, everything was much worse. Our hero went to the doctor only when he felt very bad. The man thought that frequent runny nose and cough were normal signs of getting older. However, his wife insisted that he get checked out at least once a year. But he only agreed after she had a stroke. He promised her he would take better care of himself. But what could he have done differently? If our hero wasn't too lazy to visit the doctor regularly, he might have been able to avoid the trouble. But even now everything could have ended well if he hadn't been too proud to blow off some steam. At first, the man felt pain in his side when breathing, and he started coughing. But since this didn't happen every day, he simply poured himself a glass of whiskey and watched TV. The next morning, everything was fine. So, he went to work. He felt great until the evening, then the fever started again. But then it stopped, and by the next morning, it was all over. The man thought that he had the flu and decided to take a few days off to recover. But 3 weeks passed, and he kept feeling pain in his side and having a fever. That's when he finally went to the hospital. Doctors diagnosed him with pneumonia. Fortunately, they managed to cure it. But what's scary is that pneumonia can be fatal for a person of advanced age. There are many reasons for this. The thing is that with age, the body becomes more susceptible to infections. Pneumonia can be caused by both bacteria and viruses. If a virus is the culprit, then interferon will be prescribed, which has an antiviral effect. But such treatment cannot be effective against bacteria. Here, antibiotics are needed, which not only suppress the growth of harmful microorganisms, but also destroy them. But it's not so easy to choose an antibiotic. Sometimes it takes several days for the tests to determine the type of pathogen, and during this time, the patient's condition may deteriorate. Even if we make every effort to treat pneumonia, it still leaves its mark on the lungs. As a rule, consequences are unavoidable after pneumonia. Moreover, pneumonia can lead to the development of pulmonary heart disease. Blood flow through the lungs decreases, which means that less oxygen enters the bloodstream. As a result, the left ventricle of the heart has to work more than usual to supply oxygen-poor blood to the body. Naturally, this leads to cardiac enlargement and dysfunction. But sometimes, pneumonia is a mere consequence, not the cause of a man's illness. There are conditions that already affect the lungs, and pneumonia is just another symptom of these diseases. Chronic obstructive pulmonary disease is one of them. COPD includes chronic bronchitis and emphysema. In short, the bronchi become inflamed. The lungs lose their elasticity, and breathing becomes difficult. Any infection can trigger an attack, and pneumonia is one of those. And it's especially dangerous for those who smoke or used to smoke. After all, tobacco smoke irritates the lining of the bronchi, and then the slightest infection can cause inflammation there. COPD often occurs in people over 40, and the disease progresses rapidly. An attack may come suddenly, or it may develop gradually. At first, a person feels shortness of breath, then coughing and wheezing appear, and if there are no external signs of the disease, then the person is very contagious. You can pass COPD on to others, and this happens through droplets. To prevent this from happening, it's important to wear a mask while in public places. If our hero had been diagnosed with COPD, he wouldn't have been able to avoid oxygen therapy. This is necessary to saturate the blood with oxygen. The air from the cylinder passes through the humidifier, and the procedure must be carried out continuously. Otherwise, the patient's condition will deteriorate quickly. Pulmonary fibrosis is another serious lung disease that can cause pneumonia. It occurs when the connective tissue in the lungs thickens. As a result, the lungs become less elastic, and their ability to exchange oxygen with carbon dioxide is reduced. When a person inhales, the air does not reach the alveoli, but remains in the bronchi. This can happen due to occupational hazards. For example, if a person works in mining or at a chemical plant, inhalation of toxic substances can lead to pulmonary fibrosis. Also, the disease can be caused by frequent viral infections or autoimmune disorders. People suffering from pulmonary fibrosis have difficulty breathing. At first, this happens only during physical exertion, and later on, shortness of breath accompanies a person all the time. Even lying down, a person has to be in a semi-sitting position to make it easier to breathe. Antiviral drugs and antibiotics won't help here. The only way out is a lung transplant. But this old man probably wouldn't agree to such an operation. In general, many elderly people refuse treatment. Some are afraid of the consequences. Others think that their illness is a punishment for their past. Our hero couldn't even have imagined that he'd end up in a hospital bed. He was sure that his body was strong enough. But that's the problem with ignoring your health. It can backfire at any moment. At first, the pain in his side bothered him occasionally. He could put up with it. But then the fever started. Can you imagine a fever at his age? Yes, it happens. And it's usually caused by an infection. If the temperature rises slowly, then the consequences can be minimal. But if it reaches 40 degrees and higher, then we're talking about a serious illness. In this case, the fever causes dehydration. The older a person gets, the harder it is for them to cope with high temperatures. That's why elderly people are advised to measure their body temperature regularly during an illness. A slight rise in temperature can be lowered with antipyretic drugs, but it's important not to overdo it. Cooling methods should be combined with plenty of fluids. What if you do everything right? Well, no one's immune to complications. One of them is delirium. A person with a high temperature suffers from hallucinations and can't sleep. But delirium is not the worst complication. Older people suffer from it after taking antibiotics. It seems that all we need to do is remember that our body is not immortal and take care of ourselves. But it's also important to know when to stop. When you're young, you think that you're invincible and don't listen to doctors. When you get older, you start listening to them, but it's too late. Therefore, the golden mean is very important. It's necessary to take care of yourself in youth, so that in old age you could enjoy your life and not spend it in hospitals. Let's talk about digestive health, shall we? It seems like something we don't pay enough attention to until there's a problem, right? But what if there's a way to spot potential issues early on? What if there's something that could help us keep tabs on our gut health without, waiting for things to get bad? Well, believe it or not, your daily routines might hold the key. Let us dive in and explore some common habits and signs that could hint at something brewing in your digestive system. Remember, this video is for informational purposes only, so do speak to your healthcare provider if you have any concerns. Habit number 1, always reaching for pain relief. Okay, let's start with something simple yet super important. You see, when it comes to our guts, pain isn't something we should just ignore or live with. Not at all. Our gut is like our body's command center for digestion. So when it's sending us pain signals, it's trying to tell us something is off. And let me tell you, we shouldn't just reach for pain relief medication as a quick fix, because that could be masking a bigger issue. Think of it like putting a band-aid on a wound. Sure, it stops the bleeding, but you still need to clean and address the cut properly. The same goes for our guts. When we pop pills to ease the discomfort without figuring out the root cause, we might miss out on identifying a real problem that needs attention. So what kind of gut pains should raise a red flag? Well, stomach pains that come and go aren't always a major concern, especially if they're tied to things like eating habits or stress. But persistent or severe pain, especially when it comes with other symptoms like changes in bowel movements, weight loss, or blood in the stools, that's something you shouldn't ignore. These could be signs of conditions like irritable bowel disease, inflammatory bowel disease, or even something more serious. It's essential to get checked out because early diagnosis and treatment can make all the difference. Habit number 2, changes in the bathroom routine. Okay, let's talk about something that's often a bit awkward to discuss, but super important for our health. Bowel movements. Yes, those regular trips to the bathroom are not just bathroom breaks. They're like check-ins for our digestive health. You see, when we eat, our bodies break down food and absorb all the good stuff. What's left over gets turned into poop and then, well, it's gotta come out. So when we're dealing with changes in our bowel movements, like going more often or not going as easily, it's like our gut waving a red flag saying, hey, something's not right here. These changes could be tied to a bunch of things, from dietary shifts to hydration levels, but they can also hint at something more serious like constipation, diarrhea, or even infections. And let's not forget about those times when, well, things get a bit more alarming, like when we spot blood in the stools. Now that's a clear sign that we need to take action. It could point to hemorrhoids, which are those swollen veins in the lower rectum, or in more serious cases, it could be a signal of colon cancer. Of course, I'm not here to scare anyone off, but to spread awareness. If you notice any changes in your bowel movements, especially ones that last for a while, it's time to schedule a visit with your healthcare provider. Early intervention can prevent small issues from becoming bigger headaches down the road. Habit number 3, skipping checkup. The dreaded doctor visits. We all know we should do them, but how many of us actually follow through? Well, skipping checkups isn't just about forgetting an appointment. It's also about avoiding the sometimes uncomfortable truth about our health. Think of it like maintaining your car. Regular tune-ups can spot small issues before they turn into major repairs. The same goes for our bodies. For instance, think back to that time when you ignored that pesky check engine light and ended up with a hefty repair bill. Similar things happen with our health. Ignoring early warning signs can lead to bigger problems down the road. Take something like acid reflux, for example. When left unchecked, this can develop into something more serious, like Barrett's esophagus. And if that's not addressed promptly, it can increase the risk of esophageal cancer. That's why it's crucial to stay on top of your health. Regular checkups allow doctors to spot potential issues early, like those abnormal cells that could turn into cancer. They've got the tools and expertise to identify things that might be beyond our perception. Plus, it's not just about reacting to problems. It's also about staying proactive. Your doctor might recommend screenings or tests based on your individual risk factors. It's like having a financial advisor for your health. By staying on top of things, we can prevent potential issues from snowballing into major health hurdles. Remember, your health is a marathon, not a sprint. And just like any marathon, it's all about consistent effort and regular check-ins along the way. Habit number 4, ignoring symptoms after binge eating. Have you ever gone on a binge eating spree? Indulging in all your favorite comfort foods and then felt that uneasy feeling afterwards? Well, that feeling isn't just your conscience kicking in. It could be your body's way of hinting at something more. Think about it. When we binge eat, we're overloading our systems with a ton of food. This can trigger a roller coaster ride for our guts. Suddenly, they've got to work overtime to break everything down and absorb what they can. This sudden surge in activity can lead to some not-so-friendly symptoms like bloating, gas, and heartburn. These are like our gut's SOS signals, letting us know that things are getting a bit hectic down under. And let's not forget about the aftermath. After a binge-eating episode, there's often a feeling of lethargy. Our bodies, especially our guts, need energy to function well. But after a binge, they're left feeling sluggish and worn out. It's like running a marathon without any training. This exhaustion can affect how well our guts digest things, leading to a cycle of discomfort and inefficiency. Now, it's not about making anyone feel guilty about enjoying a good meal. It's about recognizing that our bodies are in a constant state of balance, and when we push them too hard in one direction, like with a binge, it throws that balance off. These warning signs are like gentle nudges from our bodies, reminding us to pace ourselves and treat our guts with the care they deserve. So next time you find yourself indulging in a feast, remember to listen to those subtle cues from your gut. They might be telling you to slow down and savor each bite a little more. Habit no more Lima, frequent heartburn ignored. Ah, heartburn. That fiery dragon that likes to breathe down our necks when we least expect it. While occasional heartburn is like a minor hiccup, frequent heartburn is like a smoke signal, waving to us from our guts. It's our body's way of saying, hey, we've got an issue here, and you should probably pay attention. But here's the thing. Many folks tend to ignore it, thinking it's just a result of having a bit too much pizza. But that's like treating a fever by ignoring it. You're just letting the problem simmer when it needs some TLC. You see, frequent heartburn can be a clue pointing towards something called gastroesophageal reflux disease. It's basically when that valve between your esophagus and stomach isn't functioning properly, allowing the stomach acids to sneak back up. And let's face it, stomach acids are strong and can wreak havoc on the esophagus lining, causing ulcers and, in more severe cases, increasing the chances of cancer. It's like having a leaky faucet that keeps dripping and dripping until it becomes a major flood. Ignoring regular heartburn is like turning that leaky faucet into a burst pipe. The damage spreads and the whole house. In this case, your digestive system is affected. So whenever heartburn becomes a regular guest instead of an occasional visitor, it's time to seek some professional help. Remember, addressing the issue early can save you from a lot of trouble down the road.